Hello, Professor Lee. Welcome to China to join our future leader in pelvic extension master class.
Thank you. It's been my pleasure to come to China, especially Shanghai, to visit you and your team.
Could you introduce you and your team a little bit?
I am Peter Lee, originally from Korea but raised in Sydney, and I'm a colorectal surgeon trained, but I do a lot of oncology, including rectal cancers, colon cancers, and also sarcoma work. And I've trained to do pelvic exenteration in all types of pelvic malignancies.
Thank you. How do you think about our master class this time?
The master class was excellent. I haven't been to such a large master class. Normally master class is like 20 to 30, but you had almost 200, maybe more than 200. And it shows that the volume of interest in China is here. And so if we can collaborate and we can make PE surgery in China even mainstream, that is acceptable, and this is a pathway to have longer survival, better outcomes for patients who before could not have surgery.
You have been to so many courses. What is the most attractive part of our master class this time? What do you think?
I think the combination of having the cadaveric course is very important. You had that for your attendees, and having experts coming from all over China and some from the world to come and visit your center. I think that's the attraction. And having the experts in China, Professor Jiang, Professor Gu, being present, I'm sure that will attract many people to come.
Thank you. And how do you see PE surgeon? How PE surgeon is different from other general surgeons? What do you think?
We are different, yes, because we want to look for trouble, but we want to find a way to fix that trouble. And the biggest trouble that we find is bleeding. That is the definition, I think, of a PE surgeon. If you control the bleeding in the pelvis, then we lose our fear. Then we can do more resection, wider resection, more to the front, more to the back, bone resection. And that's because we need to get clear margin. Once we get clear margin, then the outcome for our patient is good. And this takes training, this takes mentorship, and this takes self-learning too, but also traveling to other centers to see what they do, and we can learn from each other. And that's why PelvEx is developed for collaboration. And I know China has many PE centers, and there will be great collaboration within China and then with the world.
As a PE surgeon, it usually has a very long learning curve. How did you conquer that? How did you become a PE surgeon?
How did I become? So I finished my general surgery training 2005. And then 2006, I was blessed to become a trainee for the Colorectal Society of Australia and New Zealand. And we have to sit an interview, we have to pass that interview and get selected. So I went to Christchurch first year, and Professor Frizzell was doing exenteration. And I saw the surgery and I said, yes, this is what I want to do. Bigger surgery, more challenging surgery, complex surgery. And then I met Professor Solomon, heard that I was interested. So he said, come to RPA. But before coming to RPA, go overseas. So I went to Leeds, UK, with Professor Sager and did more training there, observing, operating. And then I came to, as a consultant surgeon, 2009 to RPA, and I worked with Michael, my mentor. So I learned from him, we operate together every week. Every week we operate together. I go join him, and then he helped me if I need help with my case. So that went on for about, and still does happen now. It's been 15 years, and I still operate with him. He come operate with me with our PE cases. So we have this teamwork. And over the years, we need to improve outcomes. So we need to learn new techniques, minimize complication, minimize bleeding, and this means we need to study. We need to study MRI, we need to study anatomy, become better. So we do workshops, we do cadaveric workshops, we do teaching sessions, webinar sessions, and we do that just not in the hospital, but throughout Australia and New Zealand. That's the Colorectal Society, but then we also have international webinars. And I've been blessed enough that I have invitations to many countries, so I can present lectures, but also learn from them what they're doing. Yeah. Like here, like I'm in Shanghai.
Thank you. And I also have a question. Like, there are a lot of young surgeons that want to do PE surgery in China. If you could give them like 3 most important things to become a PE surgeon,
Okay.
what would you suggest to them?
You need to be devoted. I mean, as a surgeon, you're going to be devoted anyway, but you have to have that drive to wanting to learn more every time and get better. That's very important, to improve, to continue learning. And I think visiting other centers is very important. Established centers, go see what they do, learn from them, have a collaboration, have a relationship, so we can discuss cases, discuss techniques, how to get better. And finally, to become from a good surgeon to a better surgeon, I believe, is if you put the patient in the center and you make your decisions around the patient, not you, you're not the center, the patient is, then your decision making, your technique, your operating will become better and better, and the patient will see that. And so you have a better relationship with patient and your outcomes will become better.
Thank you. And also, as surgeons are always very busy. I see you have a lot of publications. And how you balance your research and your clinic job? How you balance these 2 parts?
Yes, I think all surgeons have this challenge. We are very fortunate in RPA. We have a research team, and we've started the database, which Professor Solomon started 28 years ago. It's called Source, and we had a prospective database for clinical data, but also quality of life data. And we as surgeons input, but we have team then to put into the database and keep the database up to date. Then we have a clinical team who will interested in PE surgery, and we have fellows coming. So we encourage them, we inspire them to say, look, you should do some research with us. We have some questions that we need to answer. And so we give them the opportunity to work together so we can publish. So we do it as a team, not one person. It's all together, the team, research team, clinical team, the consultants working together to publish. But that takes some of our personal time. So we have to make some room for the research time, for our clinical time, and very important, family time and personal time. Because if this is good, this and this is really good.
China, PelvEx-China is a part of or branch of PelvEx Collaboratives. So what do you think our work for now in China as a part of the PelvEx?
I think it's a great opportunity, and it will help PelvEx grow, the international PelvEx grow, because China is vast with many centers, 50 centers doing pelvic surgery. So adding that to international pelvis will just make it even more bigger, and we have more data. And then if we have more data, we can do more publications, we can answer questions that we still don't know. And this will be a really productive and opportunity to do even better than what we are doing. And we build friendship, we build collegiality, and then we can even work even better. And I look forward to the friendship I will have with the China PelvEx community, and really wish that they join and grow with the international PelvEx collaboration.